We are live.
Yes, yes, madam.
Good evening, Pranam and Johar. At the 114th episode of Gyan Pravah, I welcome you all. As you know, Gyan Pravah is a visionary program of our dynamic president, Dr. Sunita Tandulwadkar, madam. And it's really give me immense pleasure to host the 114th episode of it. Dr. Sunita ma'am doesn't need any introduction. Ma'am is the past president of IAG, ma'am is the current president of Fogsi, and the president-elect of ISAR. Ma'am is credited with the first stem cell IVF baby of India and first of world at the age of 45 years. Ma'am has a lots and lots and lots of awards in her credit and the work she is doing. And she is not only doing the work, she made all of us to work. And such a wonderful project, ma'am, is coming up. And really, it's a wonderful year till now, ma'am. It's been 5 months already passed, and it's like a flash of light. ऐसा लग रहा है जैसे yesterday only you took the takeover as a president and Foxy, and it's 5 year already passed, ma'am. 5 months has already passed. So thank you so much, ma'am, for always being us, for always being with us. Now, coming to ma'am, your project, which is basically for ours. Ma'am, you have a project like Sampurna. Ma'am, you have a project like Aparajita. Ma'am, you have a project like Nirmal Banaras and what not. And each of is dedicated to women's health, the health of a women of India. And today we have our very special guest for us, Dr. Syed Hube Ali, ma'am. Ali, sir. So, ma'am, I just want to request you, please give your blessings for this program and also introduce our guest for today. Over to you, ma'am.
Thank you. Thank you, Apurva. Thank you. It's 114th episode. I can't believe. I still remember the first episode on 29th of January. But we have not completed 5 months. It is 134 days today. I count every day. And it is such a great pleasure that you have taken Dr. Syed Hube Ali today. I admire him. I was not knowing sir for maybe 1.5 years ago, and we came to know he's so passionate, so hardworking, and the way he work in UNICEF is fantastic. I still remember Apurva. Before I took over, maybe 1 year ago now, when we were discussing, I wanted to discuss with the project. I was busy with my practice and all, and I requested him, can he travel down? Not knowing on what great position he is. He's so humble. He came down, and me, Ashwini, and him, we did fantastic meetings. And you may not know, our first Arogya Yoga Yatra at Tirupati, UNICEF was with us. We launched our Arogya Yoga Yatra, the theme song, Madhyam, but UNICEF has worked with us to give a Sampurna song, which we released on 10th of April. It was the UNICEF, the collaboration, and I'm so thankful to him that he has worked from the installation of our team with the Sampurna project, the preconceptional nutrition, the mental health. Preconceptional health, mental health, I think is the topic close to his heart. And we did had 1 hour discussion in our AICOG. So we are collaborated. And when I read and I saw your flyer with Syed Hube Ali sir, I told Ashwini, it is me who will be joining from whenever and wherever I am. Sir, every day, 8 p.m., 30 days, 30 chairperson. And on 31st, I come over with my spirituality. We discuss on Bhagavad Gita. What is most important is I felt in a Foxy, the chairperson is a first step of a ladder. And then you climb up, and the day you will become a president. Those who are really having a leadership quality, the gist to become. And that's why this podcast series was started, so that they can have a dialogue, they can interact with the global or the national leaders. And I thought, I am really giving the shape to my chairperson. But believe me, 114 days, I met so many faculty, and I felt, forget my chairperson, I evolved as a person. Listening to every podcast with the different angle, different view, different people from different backgrounds. Life is so beautiful, and there is so much more to do. You realize when you meet these personalities. And I definitely am thankful to each and every chairperson. They work with immense pleasure. I still remember Apurva's last podcast with Dr. Jumani. Fantastic. It was fantastic. Uh, it was a fantastic thing, and I'm so, so glad that we got an opportunity to release it once more. So today, sir, after your introduction, I give Apurva the chance to introduce, but then you both will be in the frame, sir, and I'll be listening from the viewers link, so that you both and my chairperson get the big platform of Foxy. Thank you for coming on Foxy's platform again. Thank you.
Thank you. Thank you,
Thank you.
madam, for the kind words.
Thank you.
Thank you so much, Sunita ma'am. And ma'am, we are always discussing like me, Rohan, Priyankur, we are all have the same we friends, है ना? कि Sunita ma'am is so humble, so available to everyone, and it's really an inspiration for all of us. And when I met Hube sir, oh my God. है ना? Again, he is a person. He's so much, he's in that position, but so down to earth. Whenever I call sir, he's always said yes. Absolutely, I am there. I am okay. So thank you so much, ma'am, Sunita ma'am, to introduce me with Hubbe sir, and thank you, Hubbe sir, to have accept our invitation to be today's faculty for this podcast. So thank you so much, ma'am, and thank you so much, Hubbe sir. Thank you, ma'am.
Thank
Thank you
you. Thank
for
you so
always
much
being
for
with us.
inviting
Thank
me.
you for
Thank you.
joining, ma'am. Yeah.
Thank you. Thank you, dear all. And enjoy your series, and I'll enjoy with another link. Thank you.
Thank you, madam. Thank you
Thank you.
for the
Thank
Thank
you
nice
you.
so much.
words. Thank
Thank you
you.
so much.
Thank you.
Thank you. Thank you. Yeah. So after this brief introduction and blessings from our dynamic and visionary president, Dr. Sunita Tandulwadkar, madam, now we come to very serious topic for today. And that topic is the HIV, STIs, and Indian women's. And today we have a wonderful, our health specialist, India, UNICEF, that is Syed Hube Ali, sir. So, sir, first question to you, sir. When I got to know about you, I got to know about that you have been associated with the UNICEF for last 2 decades, and where you are working with UNICEF at a various capacity, and from ladder you from there from a small person to at this position you are here, and you are also working in so-called the backward states of India, also known as the Bimaru states like Bihar, Jharkhand, Odisha, and Uttar Pradesh. Sir, just I want to my first question, what difference you are finding between the healthcare of a women in those places, in those states, and like in an other so-called developed state like Gujarat or Maharashtra or Rajasthan? Yeah, over to you, sir.
Yeah, thank you. Thank you for this question. So, yeah, you are right. I worked in these states, and now at the national level, I'm also looking at the developed states. The first and most important thing is the access to the healthcare services, where we find really a difficulty in the states like Bihar, Uttar Pradesh, Rajasthan, Madhya Pradesh, and the access to these healthcare services, which is much more near to the households of the people. Another most important factor is the privatization and the paying capacity of the people in the private sectors. If you go to Kerala, Tamil Nadu, Maharashtra, you see at least 50% of these healthcare seeking behavior is in the private sector. If you compare it the same with Bihar, Jharkhand, or Rajasthan, 30 to 40% is in the is in the private sector, rest all is in the government sector. So one is the access, the paying capacity of the people. The second most important thing is the care seeking behavior. That is most important, and it all depends upon the behavior of a person, the timeliness to seek care for any of the ailments, be it a man, be it a woman, or be it care seeking for the children. It's more in the South India states as compared to Bihar, UP, Rajasthan, Jharkhand, or Madhya Pradesh. And this is seen if you see the latest recent report of the SRS maternal bulletin. Now we again have a good news. India's maternal mortality ratio is further reduced. It's now 93 per 100,000 live births. And all the South India states have already achieved the SDG target of less than 70 per 100,000 live births. And we are still struggling in the states of Assam, Uttar Pradesh, Madhya Pradesh, Rajasthan. They are on track, but I think further fast tracking of the annual rate of reduction will be needed in these states as a whole. Yeah.
Absolutely, sir. You are very correctly said. Even I am from Jharkhand state, and Jharkhand has come from three-digit, maternal mortality to two-digit, and it has, from the position, it has come up with sixth position. So it is really a very good, and really, sir, we are thankful to UNICEF and to all the gynecologists across India, whether it's a private sector or whether it's a government sector. They are doing a tremendous work to reduce this. Absolutely, sir. Sir, second question I just want to ask you, sir, you all know कि in India almost, sir, 60 to 70% of the healthcare is provided by the private sector. Okay, so sir, what is the role of private sector and what they can contribute so that we can further improve the health of a women in India, sir?
Yeah,
What
so
expectations have UNICEF? Yes, sir.
so yeah, the private sector average is 52% role in the healthcare services for India. It's more in the South India state and less in the central part or the northern part of India. But the role of the private sector is most important because now people are moving towards the private sector. Two things are most important. One is the quality of care, because a quality of care can reduce by 50% the maternal mortality and by 70% the neonatal mortality, and that is true for the private and the government sector. For government sector to improve the quality of care, government has the national flagship programs, the national quality assurance standards, the Lakshya program, Muskan program. Most important in the private sector, if I talk about the maternal health, it's the Manyata program which Foxy is owning and Foxy is doing it, which looks at the quality of care of the woman to a very large extent. So first and most important thing is the quality of care. Next most important thing is the affordability of the care of services. And in India, we have the Pradhan Mantri Jan Arogya Yojana, the largest insurance scheme where to the deprived society, part of the society, there is an insurance package of 500,000 per family. And many of the private hospitals are also empaneled under the PMJ insurance scheme, so that the people who cannot afford the money can also avail the services of the private sector who are empaneled by the PMJ insurance scheme. So both the sides are most important. First is the affordability to the private sector, and second most important is the quality of care. And I think as Foxy is really taking care of both of these sides. And now we see year after year in the NFHS 4 to NFHS 5, the deliveries or the antenatal care in the private sector is increasing because the trust of the people in the private sector is increasing, and the quality of care, I think Manyata program speaks itself. Yeah.
Absolutely, sir. And really, we are very thankful to the Foxy leaders. And you correctly said, sir, that they are taking care of both the things and of the private sector as well as the public sector. And, it's a collaborative effect of both of them, which can make the women of this India more healthy and definitely help reduction in the maternal mortality and morbidity. Absolutely correct, sir. So now the next question, which actually come from my committee only, about the STIs. Sir, you are also closely associated with the HIV and STIs. Sir, what's the differences? Have you find it more prevalent in a urban area, or you are thinking that it's a more prevalent in a rural area? because there is a somewhat lack of awareness of contraceptive, or lack of awareness about the STIs. What your intake in that, sir?
Yeah, so let us differentiate it. Let us talk differently of the STI and let us talk about HIV/AIDS as a separate issue. However, you might be aware that HIV/AIDS is also a STI, it's a sexually transmitted infection. So if I talk about STI, the surveillance of STI in India is done mainly for the syphilis, and other STIs they can go to the Suraksha clinics at the district level, which is owned by NACO. They can go at the PHCs, at the CHCs, and etc. Now for India, if I talk about STIs, I have to talk about syphilis. Now testing of the syphilis is done at two sites. One is during the antenatal care period. It's mandatory to do the testing of HIV, mandatory to do the testing of syphilis, and the hepatitis B. So triple elimination we are looking at. And for the blood donation, our government has made it mandatory to do the testing of syphilis and HIV. Now the data shows, there are many studies which shows that the trend of syphilis is increasing globally prior to COVID and post COVID. Now, there is a study recently released, you might be aware, 2 weeks back, there is a Lancet journal for the Southeast Asia region has been released, and there is a commentary on syphilis increasing trends in India. In 2019, they compared 2019 to 2024. Now, for the blood donation, now it says that the syphilis incidence among the blood donors has increased from 130 per 100,000 blood donations to 450 per 100,000 blood donations. So there is a drastic increase in the syphilis, and also NACO has showed this increase from 0.01% to 0.7% in the antenatal clinics. So yes, syphilis is a tip of the iceberg. So once syphilis is increased, we can also think of the genital ulcers which are increasing, be it herpetic, be it non-herpetic, and the urethral discharge and the other STIs might be increasing in the country. Now another thing is HIV. So I deliberately kept it different. HIV prevalence in the country is decreasing. It has decreased by 44%. The annual new infections has decreased. If you compare 2010 to 2023, by 44%, the annual new HIV infections has decreased because the surveillance of HIV is more as compared to surveillance of STIs. And also the death of the persons with HIV, AIDS related death has decreased by 79% in the same period, 2019 to 2023. However, having said that, in terms of absolute numbers, India is the second highest number of people living with HIV. We have 2.5 million people who are HIV positive. So the numbers are huge for us. We need to look for the STIs. Government and the stakeholders understand that there is an increase in the STIs in the country, and we need to work around it. Yeah.
Absolutely, sir. It's very, and it's a really good news that the trends is decreasing, incidence is decreasing, and HIV related complication and deaths are decreasing. And which I also find in, like, in the previously we have more HIV patients during our residency, but now somewhat it's decreasing. Absolutely, sir. But sir, I just want to ask you about the HIV, because there is a now the sexual risk taking is more in the youngsters. So do you find it there is a shift of the HIV from like HIV-1, HIV-2 to that, or it is still the same, or it is decreasing?
Yeah, this is a very important question. I think let us focus on the youngsters. NFHS 5 says that the first sexual intercourse, the first sexual debut in a woman, it says that 10% women will have the first sexual intercourse before 15 years of age. 13% will have first sexual intercourse before 18 years of age, and by the age of 20 years, 60% will have the first sexual intercourse. The median age of the sexual intercourse for a woman in India is 18.9 years. Now, but here you remember, NFHS 5 says 23% of the women are married in the teenage years. Now, if I look about the contraceptive, unmet need of the contraceptive, in India it is decreasing. It is 9.4% as per NFHS 5 for the general population. But for people less than 19 years or 18 years, it's 18%. So that is the issue. The median age of the first sexual debut for the males is 25 years, for the female is 19 years. So there is a gap. So you can imagine the bargaining capacity to use the protective methods or bargaining capacity of a female bargain with a person who is 6, 7 years older to use a condom is there is a gap in that. That's the reason for the contraceptive failure in spite of the fact that you have that knowledge that using the condoms will reduce the STIs, NCIs incidence. Now again, the multiple having multiple sexual partners is another risk factor for both HIV as well as STIs. What did the data say? NFHS 5 says a woman will have 1.7 lifetime sexual partners. Male will have 2.1. On an average, it comes to one person in India having two sexual partners. So that's a point which we need to reiterate in spite of having marriage or non-marriage. Extramarital sex is one of the reasons for the syphilis. There was a very good study by Gupta in the Indian Journal of Dermatology, who the number were 91 or 90, the numbers were low, but the risk factor, he said that 52% of the syphilis cases were due to the extramarital sex, where you are not using the protective measures, and some parts were due to paid sex, some part due to MSM, and so on. So this needs to be taken care of. Yeah.
Um, Hello.
Can you hear me?
Um, Yes, sir.
Yes.
Yeah. Hello. I think, sir, there is some technical problem in that. Huh. Okay, sir. After that, just I want to know from you, sir, because we are getting a lot of patients of HIV as well as the syphilis, HIV. So, being a gynecologist or being a doctor, is there anything sir, what precautions should we take when we are dealing with this type of patients? I'm talking about for the pregnancy also, as well as talking about for the non-pregnant also.
See, the data released by the NACO, it shows that 55% of the pregnant mothers are already, they know their status, that they are HIV positive. So once the status is known, it becomes easy for the doctors, for the gynecologists, for the medical officers to use the universal precautions where we are dealing with the patients who are, or the person who is HIV positive. 19% of them will be recognized in the first trimester, 16% in the second trimester, 9% in the third trimester. Now, the point is 4% of the pregnant women will show up that they are HIV positive at the delivery table. That's the point. That's the catch. So the message, general message is for all of us, without any stigma, without any discrimination, we should use the universal methods of the protection. You use the face cap, we use the gloves for it. You use all the universal precaution measures when we are dealing with any person, because even a normal looking person can have this HIV AIDS issue. Now we have HIV related act which says that there is no point in discriminating a person who is HIV positive. So on the part of the doctors or the healthcare professional, the universal precaution needs to be taken and the person needs to disclose. We all need to work together to remove that taboo or the stigma or discrimination with HIV AIDS, so that the people come up and say that yes, my status is positive, so that the person treating is also aware and the person who is HIV positive is also aware what all precautions needs to be taken. Can you hear me?
Absolutely, sir. Yeah, yeah, absolutely, sir. My voice is audible, sir?
Yes, yes, yes.
Yeah, yeah.
But your
Okay.
video is, I think, open.
Yes, sir. I don't. Probably I am, sir, traveling, and
No worries, no
there
worries.
is some technical problem in that. I'm extremely sorry for that. So after this, sir, when we are talking about HIV, STDs, sir, do you find that there is some difference between those, sir, in the rural as well as the urban area about the awareness, or when we are treating this patient, it is more difficult in the a rural patient or in the urban patient?
Yeah, so rural urban difference, particularly it is in the awareness or the knowledge of the comprehensive HIV AIDS. So comprehensive HIV AIDS knowledge is more in the urban area, it's less in the rural areas as per the NFHS 5. What is more important is the communication, the awareness. So it has been made mandatory to do the HIV testing for the pregnant women. Now, when a person is found to be positive for HIV, government is doing the index testing. You need to to show up with whom you are doing the sexual part of it, so that he or she can also be tested, so that in a cascade manner all the persons are tested at the same time. There are two issues. Now, urban areas, you have the facility, you have that access to the labs, government as well as the private. In the rural areas, at all the government facilities, they are doing the test. Now, government has also started the scheme of testing the HIV, syphilis, and hepatitis B in the outreach sessions. So in some of the states, it's called as VHS, and the Village Health Sanitation Nutrition Day, where you have the test kits available to do the HIV testing, and if found to be positive on the test kit, they do the confirmatory test. So the access barrier is now being reduced by the government. I think it's most important is the awareness part. Awareness, it can be done through the mobile, through the frontline or the healthcare workers. It can be done through various modes of social media channels, as well as television, as well as the IPC, which the ASHA workers can do. So awareness is a barrier. Nowadays, logistics or access is not much a barrier for actually the HIV testing, but I think still there is a lots of gap, because the comprehensive knowledge for HIV as per the NFHS 5 for the males is 31%, for the females is 21%, and there is a huge gap there. So awareness is the crux of it for coming forward for doing the HIV testing.
Absolutely, sir. Sir, it's all about you are talking about the HIV. What my because I have also seen the patients, sir, and I think watch in the last month I have seen the 4 cases of gonorrhea. Okay, in case of definitely in case of male. So, sir, is the other STDs is also increasing? You talk
Yes.
about the syphilis,
Yes,
sir.
see, as I previously mentioned, syphilis is the tip of the iceberg. If syphilis is increasing, definitely the other STIs like gonorrhea, like herpetic or the non-herpetic genital ulcers, urethral discharge due to any other reasons, or the vaginal discharge might be increasing. We do not do the surveillance of each and every STIs, although government is doing it from the STI clinics, Suraksha clinics, the district level clinics. But the tip is the data and the outsource is of syphilis. If syphilis is increasing, yes, the other of the STIs are definitely on the increase, and we need to take care of it. And most important is the use of the condoms. And I think most important is the comprehensive sexuality education as a whole, for the students, for the adults, for everybody of us, to understand how to prevent ourselves from STIs and HIV.
Absolutely, you are very you discuss with a very important topic about the sexuality education. And just for the audience, I just want to congratulate and just thank you to Sunita madam because Sexual Health and STI committees bring out under guidance of Sunita madam and previous Foxy president, we are coming with the sexuality education module, which is for the high school. So I think, sir, you have bring out very, very important topic that the sexuality education is very important to prevent these STDs. So thank you so much, sir, and for bringing out this very important topic. Sir, now, sir, how? It is straightforwardly, I just want to ask you, how we can improve the health care system of our own country. Now, sir, previously last year, I was in AOFOG, that is the Asia Oceania Federation of Obs and Gynae, and I represented India in community fellowship program. And we have 18 fellows from different countries, including all the SAARC country people from the China, from Japan, Malaysia, Nepal, and all countries. And what I feel that in other countries, probably due to the less population, to manage the things are a little bit easier because in their labor room, probably I have seen one of the largest, I have visited one of the largest hospital of Seoul, and it has but the 1 month delivery of our hospital, like AIMS and big institute, it's the total delivery of 1 year of those hospitals. So, sir, how to improve the healthcare system of our own countries when we have such a big population and we have such a lot of challenges are there.
Yeah, so India has a very robust healthcare system. It has because health is a state subject in the country as per the constitution mandate. We have the district hospital, and then we have the blocks, and in the blocks we have community health centers, primary health centers, and the very good initiative under Ayushman Bharat has been taken by the Honorable Prime Minister, where we have Arogya Ayush Mandir, which were previously called as the Health and Wellness Centers, which is the lowest level of the care of the facilities. And under one of the part under the 12-point care packages is the STIs, HIV, AIDS, SRH, knowledge. Now, another part of the Ayushman Bharat is the school health and wellness program. So school health and wellness program has 11 different modules. So if as you mentioned, I will go to the logistic next part. If Foxy is also trying to do the comprehensive sexuality education, please try to see it that it has total 8 components. The CSE has 8 components: human body, then health and well-being of a person, relationships, values, then we have understanding the gender, then you should have this violence, because Foxy also have a committee on violence, sexuality, sexual behavior, and sexual and reproductive health. All these 8 modules are already part of the school health and wellness program. So at one time, at one part, Government of India is making the capacity of the persons who are entering into the adolescent age and so on. On the other side, we have the community health officers under the Arogya Mandir, where they are providing these comprehensive sexuality services. The contraceptives are now available with the ANM, with the ASHA, and also at the health and wellness center, these Ayush Arogya Mandirs, and so on. The system is catered. We have the syndromic system approach of management at all the levels, and we have the Suraksha clinics. Now the system is, if a person comes, you have STI, they will identify the spouse, and spouse counseling is done, and it is being done. Now you see the data. We have reached the for example, the crux is surveillance we do for the pregnant mothers to see what is the large picture. Now government is reaching 87% of the ANC care is being enrolled. Now, 85 to 87% HIV testing is being done. Also, the syphilis testing is being done. Once they identify it, they are also able to start them on the ART. With the coverage is more than 95% in the country. The last 95, 95, 95, the last 95 is already achieved. The challenge is between identification of a person and starting of the ART therapy. There is some time lap, or a time is lost. For example, if a person comes to a outreach clinic, for example, and you do the testing for the 3 diseases, syphilis, HIV, and hepatitis B, the person is found to be positive. That person needs to go for the confirmatory test to the standalone ICTC or any other ICTC or the primary health care. Now, if the person does not turn up there, there is a gap. Now, the person who undergoes testing is now again referred to the ART centers where they start the ART. There is another gap there. But once the person starts the ART, adherence needs to be there. The government is doing the viral load testing at every 6 months to identify the we are taking the medicines or not. So if these gaps can be reduced, I think that is the challenge which is remaining. Otherwise, it's a robust system. The system is made so much that apart from the healthcare facilities, you have the healthcare workers, volunteers are there, partners are also supporting. So identification of a person and taking that person to the IRT centers where the drugs are provided free of cost. There are some gaps and issues which government is trying to fix it up through the RCH 2.0 portal, where you have the name-based tracking, unique number and identification number. But I think this gap still remains, but it's being taken care of.
Absolutely, sir. You have very correctly said that it is we have a very important role. We have a very pivot role, and definitely, sir. You have told of all the things, the private part as well as the public sector. Sir, what you are thinking, what is the role of the Foxy? Because, sir, you are associated with the Foxy, and you have been Sunita ma'am before also. Even I first met you in the AICOG Hyderabad 2024. And, sir, what's you find the role of the Foxy in improving the healthcare system of the women's of India?
Yeah, I think Foxy is doing the fantastic job now under the leadership of the presidents, past presidents also. And you are reaching, you are doing apart from the clinical part, I think the continuing medical education is being done. And apart from that, under the leadership of Dr. Sunita Madam, the health awareness camp, the mega fairs, Arogya Yoga Yatra is also being done to reach the masses with the preventive messages and the preventive healthcare checkups. And one of the suggestion which you already mentioned is coming up with this comprehensive sexuality education, because Foxy societies own the schools. For 2 years in during the COVID time when were in the lockdown, and we did the with Shanta Kumari madam when she was president, along with the partnership of Foxy, we have been able to reach 200,000 students in the schools for gender-based violence. Again, under the leadership of Dr. Tank, Jaideep Tank, we were able to reach large number of the students through for the cervical cancer and HPV messages. And again, now Dr. Sunita Tandulwadkar madam is doing, we jointly developed the preconception care module. So, and now you are developing the comprehensive sexuality module. I think most important part is to adopt those schools, because the message, if you teach a student in the school, the message, the ambassador, the student will carry this to the family, and through family to the society. So it's a very good step, I think, and I must congratulate the entire Foxy for this important initiative of the public health apart from the clinical practice which you are already doing.
Thank you so much, sir. It's really, and we are really blessed to have a partners like you, sir, who not only guide us, but help us to reaches to mass, sir. So thank you to UNICEF also, because since ages it's a partner of our Foxy, as well as for improvement of the women's health in India. Sir, just I want to ask you about some interesting cases or some interesting thing which you want to share, which you are finding like interesting, and it is really a path breaking in the health of the women's of India. Anything, sir? Anything you want to share, sir?
Yes, so I think I look for mental health and adolescent health and HIV/AIDS. So most important is the adolescent piece, because we all know that India is a young country. It's the most populous country, but at the
Absolutely,
same
sir.
time, it's the youngest country in the
Young
world.
country.
Our
Okay.
median age of the population is 28 years, which means 50% of the population is less than 28 years, 50% of the population is more than 28 years. Now, the youths and adolescents are most important. We did youth consultations since last 2 years. We are doing the youth consultations on the emerging adolescent youth issues. One of which is gender-based violence. We are talking with the youths and adolescents for comprehensive sexuality. We are talking for the road safety part of it, and we are talking for the climate change. Now, we have collected the voices of the youth together on these four important topics. And these voices of youth were collected together into an outcome document, which the Honorable Union Minister of Health in one of the G20 co-branded event was released. It had the broad recommendations, bold recommendations for improving the sexual reproductive health, for the road safety, for the injury, violence, gender-based violence, etc. And this was then taken up by the Niti Aayog. They called all the departments together, and the National Curriculum Framework for School Education is now having all these emerging issues into the curriculum of the student. The comprehensive sexuality education and everything, road safety, gender-based violence is now being built in mandatorily into the curriculum. So I think the youth, voices of the youth is most important, because what we feel, you or me, we are doctors, we are looking from that angle. Most important is what our youngsters feel, how they wanted to fine tune the program. And I think that is one of the cases now. uh, Being motivated by the voices of the youth, we are now engaging with the youth on 18th of every month, along with the Adolescent Health Academy of the IAP. I would also invite the Foxiers to also join this, because we are taking the emerging adolescent health topics in each of these 18th webinar, and the youth are coming up and talking their causes and concerns, and we'll be collecting at the end of this year all the voices of the youth to further, which will be used for fine-tuning the program. So I think it's a very good initiative, and voices of the youth are most important at this point of time.
Absolutely, sir. And thank you so much for giving it such a great importance. And what you have told, sir, ki yes, we are Indians are the young country and youth are very important. And when we are focusing on youth, they will tomorrow they will be adult, and so definitely it will be beneficial for all of them. So, sir, this is the thing. Sir, next we are talking about what we till now we have done and what's our achievements and all. Sir, according to you, what are the key factors which we need to improve to, for improvement of the health of a women, including, sir, the mortality, including, sir, morbidity, including the other things like, sir, the HIV, AIDS, or the cervical cancer.
Yeah, so first and most important thing is the awareness is the most important thing. I think that's a lots of scope to improve because the comprehensive knowledge of the sexual health or the comprehensive knowledge of HIV/AIDS among our women is very less. It's only 20% in the youth and adolescents, and it's 21% in the general population 15 to 49 years of age. So first and most important is the awareness generation, which is most important. Next is the appropriate knowledge through the various sources. And I think this podcast, which is being done by Foxians, and also we worked with Dr. Sunita Madam to develop a Nari app, which gives you and which gives apart from the health paternity, it also gives the woman the right to know what is the issues and what needs to be done. That is most important, and I must congratulate Foxy for that. The third most important thing is improving the care-seeking behavior, and it can be done only with the confidence. So I think the Nari app again will help this. Now, for the cervical cancer, Government of India is coming up with the HPV vaccinations, and it will be given because it's also a part of the United Nations SDG target to eliminate cervical cancer by 2030. So it's also being done on that part. The next most important thing is the empowerment of the women. Still, 30% of our currently married women, as per NFHS 5, are victims of the gender-based violence or the spousal violence, and lot needs to be done for it. And I think none other than Foxy is in the forefront to talk about gender-based violence. It's no longer a thing which is behind the back doors. It now needs to come up. Now the National Crime Records Bureau also reports this, and the cases are increasing, particularly after the Nirbhaya case. The cases of rape and everything are now being reported in the country, and I think none other than Foxians are in the forefront to spread this message that this is no longer a thing which is to be behind the doors. I think we all need to join our hands together to reduce the gender-based violence, because unless and until our women are empowered, they will not come forward. They need to come forward. Another good thing NFHS 5 says, the engagement of a woman in making the decisions. Now, currently it's 88%. Women are making three decisions. One is decision regarding their health, decision regarding when should I go to my own family, and the third thing, decision in the major household purchases. But decision to go out, decision for health seeking behavior, these all things also needs to be captured. And I think for this, the empowerment for the women, it's responsibility of everybody of us. But anything for the woman, by the woman, for the woman is Foxy. So I think Foxy is in the forefront, and all the partners, all the stakeholders must support Foxy for this very important initiative, apart from the clinical practice.
Absolutely, sir. Thank you so much for giving such a brief about how we can do and what we can do. And just to inform you, sir, I think you are also part of that, that we have developed the Sakhi app. And sir, you are one of the forefront to inaugurate that on 10th of April in New Delhi, sir. And it's really a wonderful app, and everybody, it is for doctors also, for for patients also. They can download the app. It is available in Play Store, Google Play Store, and they have get all the information about 360 degree information about the women health, starting from the adolescent health, starting from the endocrine, the sexual health, the pregnancy related, and etc. And thank you so much, sir. You also helped so us a lot for developing that ad. So, sir, before we stop and finish this podcast, just I want to ask, sir, what is your take-home message for we as a gynecologist, and that we should apply so that we somewhat give contribution for improving the healthcare system in India, sir? What's your take-home message, sir?
Yeah, my take home is I think this podcast is really doing wonders, and I could understand that it's being done daily at 8 p.m. So we'll also amplify from our side for the women who are really interested, for the adolescents and youth. Not only women, it's I think it's important for everybody of us to understand from the experts. The daily podcast is most important part of it, and the other programs which Dr. Sunita Madam is doing is like the mega fairs, the preconception care. We also supported through the perinatal mental health, and it's on the agenda of the madam. Is all most important. My only take home is the public health aspect of the Foxy, which you are doing. I think it's a fantastic job, and it will help the country not only for the prevention but also the promotion of the healthy lifestyle messages. So I think congratulations for it.
Thank you so much, sir. And it was such a brief but such a important podcast regarding healthcare system of a women of India. And really, this podcast will bring knowledge to all of us, to all the viewers. And definitely, we are going to apply this what you have advised, sir, and will definitely improve the healthcare system of women of India. And before I just end up, sir, what you have stated, yes, and Sunita madam is wonderful. She had a lots of project like Sampurna, like Aparajita project, the Nirmal Ganga project, Know Your Number, Rog Arogya Yatra, and what not. We have Arogya Sakhi app is there, and we have Gyan Pravah, Gyan Deepika, and each and everything is dedicated to the women's health. And definitely, this year is going to be a milestone in the history of Foxy, as well as for the Indian women's, that we have done so much thing for our women. So thank you so much, sir, for always being there, and definitely in future also we will invite you to have this wonderful conversation, sir. Thank you, sir. Thank you so much, sir.
Thank you so much.
Thank you. Thank you so
Bye
much, sir.
bye
Thank you.
bye bye.
Thank you. Bye, sir. Bye, sir. Bye, sir.